Hey, it's Roz. I'm back for Roz's journey, and I actually have been trying to do this for the past like couple weeks now since I've been missing. It's been because each week I've been trying to do the same thing. So one more time, I'm gonna try and do it, and hopefully this comes out right because I'm gonna do it anyways, regardless. Today I am talking about a personal topic, so stay tuned. All right, so today I want to talk about endometriosis. Endometriosis is a medical condition. It is when the inside of a woman's lining, the lining of the uterus, the part that sheds where you have your period, the part that grows so that the baby can grow, is found outside of the uterus. So that is exactly what it's called. And I wanted to give some information about it and just give some thoughts. So I will post a picture here. This is what endometriosis looks like. It is, I say here, but I'm not because I keep trying to do that and it's not going to happen. So what I'm going to do is as soon as I stop talking, I'm going to have a picture. But it is when there's sites actually of the endometriosis and they're not where they're supposed to be. So here it is. Okay, so the cause of endometriosis. No one knows the real cause of endometriosis. There is a consensus that the medical profession, some of them believe that it is caused through what you call retrograde menstruation. That basically means that when we menstruate or we have a menstrual cycle period, some of the blood flows into the fallopian tubes and into the body as opposed to outside of the body to be discharged with the rest of it. Now, the problem with that I see is that every woman goes through that. So that's not something that's only seen in women who have endometriosis. There is another. There's like three. The second one is when they think that the body actually has. Is it three? I'm trying to make sure. I'm trying to look. I know two for sure, so I'm like thinking two, but I'm gonna stop and I'm gonna look and see if there's a third one. But the second one definitely is where they believe that these actually implants are there from when we were created, when we were first created, and through development and as y'all know that we come from one cell and then we split, and so every cell has the ability to be every cell, and some of those cells become either they become endometrium cells even though they're not in the endometrium. So that's where we get endometriosis from. But hold on one second, let me just make sure. All right, so just to make sure, there is those two, and then there is another one that says that the some kind of way the cells enter the bloodstream and then they're able to be distributed somewhere else in the body. So those are different ways that people think that endometriosis is made, but no one really knows for sure. There isn't anything concrete. The most popular is the retrograde theory, but endometriosis has also been found in men, and it's been found in lungs and the brain. It's been found everywhere. So that's, to me, not the best idea. So I also have different symptoms for endometriosis. I am trying to do this really cool and well, I don't know about cool, but helping out. Some symptoms of someone that you might know that might have endometriosis regardless of the age. It would be, first off, painful periods. Painful periods is number one, of course. Not all the time, but painful periods. Then we have not just during the menstrual cycle pain, but pain at ovulation. It's called middle smirts. But when you have endometriosis, it is more noticeable, so actually kind of when you ovulate. Uh, Pelvic pain between the periods, which might not even be mental spurts, but it just might be just pain in general areas, because the idea about endometriosis is the lining is actually growing and it's responding to the different hormones that we have in our body. And as it's happening in the uterus, as it should, it's also happening in these other areas, these transplant areas, where it should not. So your body may start to attack it because it might see it. It is definitely foreign in that area, and it might see it as a invader. So it may start to attack it, heal, cover it. What do you call it? I'm trying to think. I'm like, you cover it. You also, you bind it. So there's binding to that as well. Painful sex includes that as well. Same thing. Not only is it during your period or when you ovulate, it could be any time. It is also with sex, because that is a drawing motion. It's moving things, and if this is happening in your body and your body is trying to bind it up, it creates scar tissue, so everything doesn't move as freely as it should. So some areas may hurt. Pain opening bowels, which also includes basically having a bowel movement. So and I mean, that's all. It's the different organs down there. You have the bladder, you have the bowel, you have the uterus as well. If this is all in that area and it's keep making stuff harder, not only is it going to be harder for you to have a bowel movement, you may have bleeding with your bowel movements. You may have bleeding with urination. It might be in your bladder. It may be pain on urination, especially during different times as well. And let's see. You also have more fatigue because your body is really in a constant state of fighting itself. And there may be other unusual symptoms that people might see or might not see. You could even have external bleeding, because if it comes to the skin, to the layer of the skin or something, there could be just bleeding there. There is increase in PMS, premenstrual syndrome, breast tenderness, infertility. So it may be difficult for you to get pregnant as well, because your body just thinks everything is like it's attacking everything. So that is a lot of the different symptoms. So now that I talked about what's the cause. We don't know. The different symptoms that we can have. Of course, there's other symptoms. If you know any more symptoms, you're very, very welcome to put them at the bottom. Talk to me. I enjoy anybody who talks to me, so thanks if you do. I'm just thinking. So, endometriosis, there's different ways to think that you have endometriosis. Of course, you have these different symptoms and you go to the doctor, of course, or nurse practitioner like me. I'm a nurse practitioner, or physician's assistant, or someone in the medical field, and you tell them your symptoms. There's not really a good blood test to do, so that's not the best way to go for it. You can get an ultrasound done, but the ultrasound is not really reliable as well. An MRI shows some things. Actually, it does, an MRI and a CT scan, but the clinical gold star diagnosis to how you know for sure that you have endometriosis would be a laparoscopy. A laparoscopy is when you take a laparoscope, goes in the lap, if that makes any sense, but it goes actually through your belly button, and then it's a small incision, and then they also do some other incisions lower, and they fill it with nitrous oxide. They fill it with gas, and go in, and they take a scope, which is a light, and they look at the top of the pelvic area in this situation to get a visual representation of it. I mean, of course, you can do a laparotomy where they actually cut your side off, but that's your lap or your lower abdomen. But that actually is like difficult to like heal. It's not difficult, but it takes longer to heal. A laparoscopy doesn't take that long. It's a couple incisions. Um, but that is how you find out. And when you get a laparoscopy, you can get a staging of the. There are multiple different stages. So, hold on one second. All right. So I actually really couldn't find it, and that's because, well, I probably haven't looking that hard. I don't want to go through it right now. I'm just gonna talk for myself. There are different stages. There's 4 different stages, anywhere from 1 to 4. Obviously, if they find endometriosis, from the very beginning of it just being there, it's very light, and to the 4th stage is severe. Is everywhere. There are a lot of adhesions. Adhesions is basically like glue to where your body is like kind of try to trap it, like I was saying earlier, and it's like sticking together, so everything is stuck together. There could be something called chocolate cyst, which is basically the endometriosis is in the ovary, and there's blood, and it's in a capsule, kind of like, like you take Tylenol or something. It's in a capsule, and it can grow, but it's called a chocolate cyst. So that's part of stage 4. So there's these different stages that they figure out what you have, and regardless of those stages, you can be in stage 1 or you can be in stage 4, and your pain may be more severe in stage 1 than it is in stage 4, but they're different stages, and you could be infertile at stage 1 and very fertile at stage 4 as well. That has nothing to do with it, but those are our different stages, what we have. And treatment, there is no cure for endometriosis. Regardless of what anyone says, there is no cure. They can alleviate the symptoms, but it in and of itself doesn't really go away. So medically, what they do, treatment for endometriosis, would be first off birth control. Birth control being the simplest method. Hopefully, if you aren't ovulating and going through the cycles, then whether it's the Mirena or the Depo shot, something that basically keeps you off of getting a period and everything else, then that's part of the cure. Well, it's not a cure, but that's what they're doing. The only real cure, if it is a cure, would be menopause, and even that, I mean, there's women who went through menopause and they still have the symptoms from endometriosis, so it is what it is. As I think, after you say, like, okay, you have the contraceptives, basically, whether it's oral injections, like I said before, or the implant, you also have Lupron, which is a shot, or even if you don't do Lupron, it's another one. It's a gonadotropin releasing hormone. It's something that's going to stop your body. It's going to put you into a medical menopause. It's just like I said before, menopause might be the closest thing to curing it. If your body puts itself into a medical menopause, you don't have any of those hormones, so that will stop the growth, but it also puts you through menopause. Menopause doesn't sound that fun. So side effects being your dryness and irritability and hair loss and weight gain, and it just does not sound fun. But if you got a lot of pain from endometriosis, then you're gonna take what you're gonna take, because this pain is no joke. Another thing you can do is when you have a laparoscopy or laparotomy, they can remove the lesions, and removing the lesions help a lot with the pain. However, there still may be scar tissue that comes from those lesions, because your body like sees stuff and it's like attacked and it's like heal, and so you can have scars from there, as well as you might not get all of it. So, and even all of it, usually you don't get all of it, and some of it can just change and make itself that. It just, but surgery itself is actually really good for having it too. Pregnancy is also a semi-cure. While you're pregnant, you usually don't bleed. So during that time period is a calming part, and hopefully will help a little bit with it. But like I said before, there's really no cure. It's just how you manage it. And there is different things to manage it, depending on the person. Exercise helps. Um, they say like low dairy, because there's all the hormones that they have in dairy. So at least going with organic with less hormones that they're giving the animals. And just making sure you're eating like less estrogen products, so low soy. That's some things as well. If you want any more information, there is a lot of information out there. Endometriosis is common. It's the second most common cause of infertility out there. It is one of the first, is a huge cause of pain, pelvic pain in women, and abnormal bleeding and heavy menstrual cycles. However, it can take 10 years for you to be actually correctly diagnosed. You may be diagnosed with irritable bowel syndrome. You might be diagnosed with just PMS by itself. You can be diagnosed with just being a woman and them saying, hey, you overreacting. But it is different causes. Some of the things that you have, they might think that is something else. So go get it checked out. I have 2 books here that I was looking at, so that's probably why I stopped a couple times. I usually don't try to stop, but I already did this twice, and they were pretty good, and I didn't really stop much, but I wanted to put pictures in it, and I didn't put any pictures in it, so I think I put maybe 1 in this one this time, but I'm trying to give props where props is due. This one is Endometriosis and other pelvic pain. I don't know when this book was written, but see, that's Dr. Susan Evans. It's a pretty decent book, and it's pretty decent. So if you want to know any more information, here's one: Endometriosis and other pelvic pain. It also includes adenomyosis and just prostaglandins, because basically prostaglandins is what causes pain a lot of times anyways, and that's just normal, like I said. But usually that is cured a lot of times, like when you have a period, when you have a pregnancy, and the uterus like kind of stretches out and then it comes back, and hopefully your pains that you had before won't be as severe. Adenomyosis is actually endometriosis, but it's when the endometrial cells is actually inside the walls of the uterus. So of course you want it on the lining to be like inside the uterus, but not in the walls, in the muscle. So it kind of like puts it on a whole different level where it's kind of trapped in the muscle layer, which sucks. But that's adenomyosis. The other book that I was looking at is Living Well with Endometriosis: What Your Doctor Doesn't Tell You That You Need to Know. And this book is kind of cool too. I haven't read it in a while, but it's it talks about some other types of management with it, and it talks about the Endometriosis Research Center. This is worldwide, so this is a pretty cool book. Carrie Ann Morris wrote this book, so with help. So that's my thing now. Sorry, this is so long. Thanks for watching. I'm Roz again. This is Roz's Journey. Bear with me. I will have another one up really soon because I really want to get this out so I can get the other one out. Okay? Love you guys. Bye.